Hello, my name is Libby Crook, and I'm a combined master's PhD student in the Communication Sciences program at Case Western Reserve University. I will be presenting today on a study regarding social participation in elementary students with traumatic brain injury, or TBI, looking at if there's an association with persistent cognitive deficits as reported by parents. Dr. Angela Chicha is my supervisor, and she will not be presenting today. I do not have financial or non-financial disclosures, and Dr. Chicha is a full-time employee of Case Western Reserve University, and she has no non-financial disclosures. The learning objectives for this study: participants will be able to identify the associations between cognitive deficits and peer relationships as it relates to elementary age students, defined as ages 5 to 9 years, who have sustained a TBI. Participants will also be able to describe long-term cognitive and social needs for this population, as well as apply findings to their clinical practice by considering the impact of TBI on social relationships and cognitive deficits for this population. For background on this study, a TBI results from an external force being applied to the head. There are different classifications, including mild or an mTBI, moderate, or severe. A TBI is the leading cause of disability and death in children and adolescents. And the most common mechanism of injury for 5 to 9-year-olds is falls, followed by being struck by or against an object, and motor vehicle accidents. The impact of a TBI in childhood is complex, as it can cause an array of cognitive and social deficits, negatively influencing a child's school achievement. So children with mTBI typically experience more subtle deficits, yet adverse effects can still be present. The symptoms of TBI evolve over an extended period of time in children, characterizing childhood TBI as a chronic disease process. Therefore, the developmental impact of the TBI resulting in academic difficulties can reveal itself within a year to several years post-injury. Because children with TBI have persisting deficits, they need to be followed to ensure they receive adequate and appropriate supports and services throughout their educational experiences. As it currently is, there's a lack of transition and coordination of this care from the hospital setting to the school setting. There's a need for evidence regarding the deficits in social relationships and cognitive abilities in elementary age children with TBI to ensure this appropriate service provision. The specific primary aim for this study was to identify the association between cognitive deficits and social participation in these elementary age students with TBI per parent caregiver report. The secondary aim was to determine whether there were differences between the average standard score of each measure, the two measures being a cognitive function measure and a peer relationships measure, and the sample mean on each measure. This is a prospective convenience sample study with electronic data collection. As you can see, the following procedures flowchart. The participants were recruited via emails, social media posts, snowball sampling, and flyers that were distributed to high school administrators, a website called Peach Jar, hospital administrators, speech language pathologists, and athletic associations. In regard to the inclusion for this study, it was parents and caregivers who had English as their primary language, as well as proficient reading skills. The participant was a primary caregiver to a child who sustained a TBI at least 6 months prior to the time of inclusion in the study, and their child had to have sustained a TBI of any severity. COVID-19 impacted participation in that the age range in participants was increased. So the child had to at least be in elementary school, again defined as ages 5 to 9 years old, but could have sustained the brain injury prior to this time. The child could be up to age 18 years old. And if the child's participant was no longer in elementary school, the parents were instructed to answer the survey retrospectively based on the time period when the child was in elementary school. For exclusion, it was history of neurologic learning or psychiatric conditions. However, due to challenges in participation because of COVID-19 impacts, one participant was reported to have ADHD prior to the sustained TBI, but this participant was included in the sample. We collected demographics and administered two measures: the parent proxy cognitive function measure, which was a promise measure, as well as the parent proxy peer relationships measure, which was also a promise measure. In regard to demographics for this sample, we had 9 participants. 6 of the participants had children who were male, and 3 of the participants had children who were female. The average age at survey in years for the children was almost 11 years old. The highest level of parent education, or the majority, was a bachelor's degree. And the majority of parents were either part-time workers or full-time workers. In regard to injury information, the average age at injury was almost 6 years, and the average time since injury was almost 5 years. We had a majority mild sample, with 2 of the children having sustained a moderate TBI and 0 of the students having sustained a severe TBI. Results for the primary aim were not statistically significant. Results for the secondary aim, specifically being the portion of the cognitive function measure, were also not statistically significant. However, the portion of the secondary aim, including the measure of peer relationships, was statistically significant. So parents and caregivers did report statistically significant lower levels of peer relationships than found in the average standardized score of the population of this measure. Further analysis on the individual T-scores of each measure was completed to see if any of the scores were 1 or more standard deviations below the mean. The mean on each measure was 50 and the standard deviation was 10. We found that 3 of the participants, or 33.3%, rated their children as having lower peer relationship abilities than the average score on this measure. These 3 participants, or these 3 children of the participants, were all male and had all sustained a mild TBI. So in a small sample of mostly students with MTBI, parents have heightened concern about the social needs of their children post-injury. This reinforces previous findings, yet extends this work by highlighting the long-term need of children with MTBI. It warrants future research on this topic, looking at the pragmatic challenges after mild TBI, seeing that cognitive symptoms might be resolved, but now we're seeing these persistent social pragmatic issues. Additionally, the conclusions of this study show the importance of parent report. Secondary analysis findings are consistent with previous research, indicating that for children who sustain MTBIs, 14 to 22% of this population will experience adverse long-term outcomes. While the percentage that we found for this sample was 33.3%, this is likely due to our small sample size. It is advantageous for children with MTBI to continue receiving services and to be observed more closely, as some of these children with MTBI might experience more severe adverse outcomes in the long term. So based on these initial findings, again, in a small sample of children with majority MTBI, further research is needed on these long-term social deficits for children to see how it's affecting their academic experiences. Additionally, it's important to keep in mind to include parent report when examining social and cognitive deficits post-TBI in children. A few limitations of this study included responder bias, a small sample size, one source of outcomes being only parent-caregiver report, as well as limited demographic information. Future directions for research include asking the question, what are the social relationship concerns of children with TBI in the long term? How are these social pragmatic issues affecting academic outcomes? Additionally, making sure to include more than one source of outcomes, including parent report as well, but maybe teacher report, self-report, and performance-based measures. Future directions for practice include increasing consistency of TBI education and services. If you have any questions, please email me. And if you would also like the reference list, please email me as well. Thank you so much for listening.